Did you know that forgetting simple things, like why you walked into a room, might mean something more serious than aging? Have you ever wondered, could I or someone I love be at risk for dementia? Is there anything I can do to stop it? Here's the good news. There are ways to protect your brain health, but it all starts with understanding the early signs and risks. Stay with us to the end, because we'll also reveal some exciting new treatments bringing hope to millions of families around the world. What is dementia really? Think of dementia as a serious communication breakdown in your brain. Imagine your neurons, those tiny messengers in your brain, trying to send signals, but the wires are frayed or completely cut off. Dementia is not just one thing. It's a group of symptoms that affect memory, thinking, reasoning, and even behavior. Dementia is not a normal part of aging. Most older adults will never experience dementia. Yes, it's normal to forget the name of a movie now and then, but dementia is different. It's about forgetting how to perform daily tasks, struggling to recognize loved ones, and losing the ability to communicate effectively. Let's clear up a huge misunderstanding right now. Growing older does not mean you're destined to develop dementia. Sure, as we age, our brains slow down a little. You might forget why you walked into a room or lose your keys now and then. That's totally normal, but dementia goes far beyond that. It's about major declines in memory and thinking that disrupt daily life. Things like forgetting how to make coffee, getting lost in your own neighborhood, or being unable to follow simple conversations. If you or a loved one notice persistent struggles like these, don't dismiss them as just aging. Instead, seek medical advice. Early detection can open the door to effective treatments and support. Types of dementia. You should know, there are several types of dementia, each affecting the brain in unique ways. Type 1, Alzheimer's disease. This is the most well-known type, making up about 60 to 70% of dementia cases. People with Alzheimer's often struggle with memory, language, and personality changes over time. Type 2, vascular dementia, caused by poor blood flow to the brain, often after strokes or mini-strokes. This type affects problem-solving and decision-making skills. Type 3, Lewy body dementia. This one brings a mix of symptoms, memory problems, vivid visual hallucinations, and sometimes even movement issues that resemble Parkinson's disease. Type 4, frontotemporal dementia. Unlike Alzheimer's, this type primarily affects behavior, personality, and speech. Someone with this might act inappropriately or lose the ability to find the right words. Why is it important to know the type? Because treatments and care strategies vary. Understanding the specific type can help guide the right steps for management and support. Let's talk about the early clues most people overlook. Recognizing these signs early could make a huge difference. First, struggling with words. We all lose a word here or there, but dementia takes it to another level. Imagine trying to say watch and instead saying, that time thing on my wrist. If someone frequently hesitates, uses vague phrases, or swaps words, it's worth paying attention. Second, changes in senses. Did you know dementia can mess with your senses? People might have trouble recognizing faces, judging distances, or even lose their sense of smell. They may stop enjoying foods they once loved because their taste buds seem off. Third, losing interest in hobbies. Does your book-loving friend suddenly stop reading? Did your chess partner lose interest in games? Apathy is a common sign, and it's often confused with laziness or depression. Fourth, muscle weakness. Difficulty buttoning a shirt or frequent falls could be linked to dementia, especially types like Lewy body or vascular dementia. Don't ignore these small motor changes. They could be early clues. Fifth, postural and walking changes. If someone starts shuffling their feet, taking tiny steps, or hunching over, it might not just be a bad back. These changes often accompany certain types of dementia. Here are 13 classic symptoms of dementia. Number 1, avoiding social interaction. Fear of embarrassment or confusion leads to withdrawing from family and friends. Social isolation worsens cognitive decline. Number 2, incontinence. Difficulty recognizing the need to use the bathroom can lead to accidents. This symptom is common in later stages. Number 3, hallucinations. Seeing or hearing things that aren't there is common in some types of dementia. These vivid experiences can feel real. Number 4, trouble solving problems. Simple tasks like cooking or paying bills become challenging. Planning and decision-making feel overwhelming. Number 5, short-term memory loss. Forgetting conversations or recent events happens frequently, yet long-term memories might stay intact. Number 6. Losing things in strange places. Keys in the fridge, shoes in the oven, misplacing items in odd spots becomes a frequent issue. Number 7. Mood swings. Sudden shifts from calm to irritated or unusual sadness may occur. Emotional changes often seem unpredictable. Number 8. Getting disoriented. Forgetting where you are or what day it is can feel unsettling. This confusion affects both time and place, disrupting daily routines. Number 9. Struggling in conversations. Losing track of what's being said or forgetting words makes discussions harder. Crowded settings can amplify the difficulty. Number 10. Poor decision-making. Wearing winter clothes in summer or falling for scams are signs of impaired judgment. Decision-making becomes unreliable. Number 11. Inappropriate behavior, outbursts, odd remarks, or impulsive actions may happen. These behaviors are beyond the person's control. Number 12. Repeating questions. The same question may be asked over and over. This happens because new information doesn't stick. Number 13. Confusion about time. Thinking it's yesterday or believing it's still morning when it's evening reflects this symptom. Days and years blur together. If you see more than one of these symptoms in someone you care about, don't wait. Reach out to a doctor for guidance. Here's the exciting part. There are things you can do to protect your brain health starting today. 1. Keep learning. Learn a new language, pick up an instrument, or try puzzles. The more you challenge your brain, the stronger it stays. 2. Manage stress. Chronic stress can shrink brain areas linked to memory. Try yoga, mindfulness, or simply going for a relaxing walk. 3. Control diabetes. High blood sugar damages blood vessels in your brain. Keep your levels in check with a balanced diet, exercise, and medication if needed. 4. Watch your weight. Excess weight in middle age can increase your dementia risk later. Small, steady lifestyle changes work best. 5. Quit smoking. Smoking reduces blood flow to the brain. If you quit, your brain's recovery starts immediately, even in your 60s or 70s. 6. Exercise regularly. Even 30 minutes of walking can boost blood flow and protect your brain cells. 7. Stay socially active. Join a club, volunteer, or call a friend. Loneliness is a huge risk factor for cognitive decline. 8. Build cognitive reserve. A more educated, mentally active brain is better equipped to handle aging and disease. 9. Eat for brain health. The Mediterranean diet, filled with fish, nuts, fruits, and veggies, has been shown to reduce dementia risk. 10. Sleep well. Your brain clears toxins while you sleep. Create a relaxing bedtime routine to get better rest. There's no cure for dementia yet, but science is making big strides. Medications are improving quality of life and slowing symptom progression. Cutting-edge research into gene therapy and immunotherapy is exploring ways to tackle the disease at its roots. Therapies like cognitive stimulation and occupational therapy are helping patients stay sharp longer. Remember, you have the power to protect your brain. Start by recognizing the signs, making small lifestyle changes, and staying curious. Don't forget to subscribe to our channel, like this video, and share it with someone you care about. Together, we can create a brighter, healthier future for our minds and our hearts.